Have you ever wondered if there are simple, almost effortless ways to restore energy and reduce everyday aches as you age? An 80-year-old doctor with decades of medical and holistic experience claims that by targeting 3 specific golden points on the body, you can dramatically improve how you feel physically and mentally, with just 5 minutes of gentle attention each day. It sounds almost too good to be true, but he insists it's grounded in both modern physiology and traditional wisdom passed down through generations. Whether you're seeking relief from chronic stiffness, better circulation, or a calming routine to settle your nerves, these 3 points promise a surprisingly powerful effect. In this conversation, we'll explore each golden point, why it works, and how to incorporate a few moments of care into your daily routine. By the end, you'll see that sometimes it's the smallest, most targeted actions that can yield the biggest transformations, especially for those in their 60s, 70s, or beyond. The doctor's story begins decades ago when he practiced as a young physician and noticed how some patients responded quickly to conventional treatments, while others seemed perpetually stuck in cycles of pain and fatigue. Curious, he started blending a bit of traditional Eastern medicine into his Western training, focusing not just on symptoms but on key points in the body that influence blood flow, muscle relaxation, and emotional well-being. Over years of experimentation, he observed that certain pressure points consistently help seniors reduce stiffness, sleep better, and even brighten their overall mood. Now, at 80, he maintains a sharp mind and agile steps, crediting his daily 5-minute routine that zeroes in on these 3 spots. He calls them golden because they're accessible, safe to work on, and recognized in multiple traditions. From reflexology to acupressure, for supporting a broad range of health benefits. The first point is located near the inside of the wrist, often referred to in some acupressure guides as the inner gate. Gently pressing this area is reputed to help with calming the nervous system, balancing the heartbeat, and reducing anxiety tension. Many older adults find that stimulating this point also helps with mild digestive discomfort or nausea, which can become more common with age. The 80-year-old doctor discovered that even a minute of mild pressure on this spot each morning helped him feel more centered, almost like hitting a reset button for anxiety or restlessness that might flare up overnight. How do you find it? Place 3 fingers of your opposite hand right below the wrist crease on the inner forearm. The point typically lies between the 2 large tendons you feel under the skin. Once located, use your thumb to apply light pressure in small circular motions. The key isn't to cause pain, but to create a mild, pleasant sensation. Focus on slow, steady breathing while you massage. If you have arthritic hands, you can use a knuckle or a small rounded tool instead of your thumb. The result often surprises people: a calmer mind, steadier pulse, and sometimes a gentle release of chest or shoulder tension that can linger during the day. The second point he emphasizes is found behind your knee, specifically the small hollow that forms when you bend your leg. Some refer to it as the knee crease pressure area. According to the doctor, massaging this region just a couple of minutes each day can enhance blood flow to the lower legs, ease stiffness in the knees, and even contribute to better overall circulation. Many older adults experience fluid retention in their calves or ankles, or they struggle with knee pain that limits mobility. Targeting this behind-the-knee spot is thought to help the body pump blood and lymphatic fluid more efficiently through the leg. The reason is partly mechanical. Light pressure and motion in this area can stimulate deeper tissues and vessels. The doctor recommends sitting in a stable chair, one leg slightly extended, and using 2 or 3 fingers to press gently in circular motions behind the knee. Try this in the morning before you become too active, and possibly again at night if your legs feel swollen or weary from the day. If you encounter mild soreness, reduce your pressure and keep motions gentle. Over weeks of consistent practice, many seniors report a decrease in the sense of heaviness from the legs, and some find they can walk a bit more easily or climb stairs with less fatigue. The best part is that it only takes a minute or so per leg, fitting seamlessly into your routine. Maybe after breakfast or right before you go to bed. The third and perhaps most surprising point is at the base of your thumb, on the fleshy pad that connects your thumb to the rest of your hand. Often called the higu area in certain Eastern traditions, it's famous for relieving headaches and tension in the upper body, but the 80-year-old doctor extends its function to stress management and overall well-being for seniors. He points out that many older people experience tension from arthritic changes in their hands, as well as from everyday anxieties about health and finances. When you press and gently rotate your thumb on the meaty area between your thumb and index finger of the opposite hand, you stimulate nerves that can reduce tension in the neck and shoulders. This same pressure point is believed to help relieve mild aches in the head or jaw, which can flare up as you strain your eyes or clench your teeth unconsciously. To locate it precisely, close your thumb and index finger together lightly. Notice the highest point of the muscle that bulges out between them. That bulge is near the center of the area you want to press. Don't dig too hard. A moderate, steady pressure for about 30 to 60 seconds, then release is often enough. Alternate hands. If you have severe arthritis in your fingers, you can use a small, blunt object or lightly pinch the area instead. Over time, many seniors say it becomes a soothing habit, like giving your hand a mini massage that also calms your mind. So how does one work all 3 points into just 5 minutes a day? The doctor suggests a simple flow you can do either in the morning or at night, or both if you prefer. Sit comfortably, free from distractions like TV or phone calls. Start with the wrist point, inside gate, for about 1 minute on each arm, focusing on slow, deep breaths. Move to the knee crease points for another minute each leg, using gentle, circular motions behind your knees, while flexing them slightly if needed. Finally, finish with the thumb base point, about 30 seconds to a minute per hand. The total routine might not even hit 5 full minutes, but the key is consistency. Do this at least once daily for a few weeks before expecting noticeable changes. Some older adults might feel immediate relaxation from day one, while others may see more gradual shifts in stress levels, leg comfort, or overall mood. Once you get used to the pattern, it can become as second nature as brushing your teeth. Just a brief, mindful practice that sets a positive tone. The doctor also recommends pairing the routine with small lifestyle enhancements. For example, while you massage the knee crease, he suggests gently rotating or flexing your ankles to further encourage blood flow. Or as you work on the base of your thumb, consider rolling your shoulders or taking slow neck rotations to ease tension in your upper spine. Essentially, each point can be a trigger to tune in to other aspects of your body. If you're worried about potential contraindications, such as if you have varicose veins behind the knee or advanced arthritis in the wrists, then consult a healthcare professional or a physical therapist for modifications. That said, for the majority of seniors in relatively stable health, these light pressure techniques are considered safe, especially since you control how much pressure to apply. Why do these points matter scientifically speaking? The doctor cites a combination of nerve pathways, blood circulation zones, and reflex arcs that converge around these areas. The inside wrist, for instance, is loaded with nerves linked to heart rhythm regulation and your body's relaxation response. The knee crease affects major vessels supplying the lower leg. The base of the thumb region, with its dense cluster of nerves, can modulate tension in the upper body. Traditional practices like acupressure or reflexology have known for centuries that pressing these zones can yield systemic benefits. And modern studies on nerve stimulation back up the idea that localized pressure in certain spots can reduce stress hormones or help manage pain signals. For seniors who often face a blend of circulatory challenges, joint discomfort, and stress regarding health changes, activating these points becomes a gentle, non-invasive remedy that rarely conflicts with medications or standard treatments. The 80-year-old doctor readily admits that these points aren't a cure-all. They won't reverse advanced chronic illnesses or eliminate the need for proper medical care. But in his extensive observation, seniors who integrated this small daily routine reported feeling more in control of their body, less prone to the cyclical slump of minor pains and anxiety. He also emphasizes that the mental discipline, pausing each day to focus on these points, acts as a mini mindfulness exercise. You pause your stream of worrying thoughts, you pay attention to your breathing, and you gain a moment of calm reflection. Emotional well-being and physical well-being are interlinked, and these 5 minutes can be an anchor that steadies you amid the unpredictability of aging. You might wonder if 5 minutes can really make a difference. It's a common skepticism, especially when we're used to hearing about the need for extensive exercise programs or complicated dietary changes for meaningful health gains. Yet tiny, repeated actions often have cumulative effects. A single quick session might lower your stress or ease your knee stiffness just a bit, and a few weeks of routine can amplify those benefits. As the doctor likes to say, it's better to do a little bit every day than a lot once in a while. The consistency helps your body form a new habit of relaxed circulation and tension release. Even seniors with advanced mobility issues can adapt these techniques to a comfortable seated position or do them in bed if necessary. Another plus, it doesn't require special equipment or even a big chunk of free time. Whether you live at home independently, in an assisted living environment, or with family, you can incorporate the routine seamlessly. After breakfast, during a TV commercial break, or right before turning out the lights at night. If you forget one day, just pick it back up the next. Over time, you might refine your approach to see what works best. Pressing the knee points a bit longer if you have leg discomfort, or devoting more energy to the wrist points if you're anxious. It's entirely customizable and within your control. An empowering fact for those who feel everything else about aging is out of their hands. Many who adopt the practice say they also share it with friends or loved ones. A spouse might help press the behind-the-knee point if you struggle to reach comfortably. A friend with arthritis might thank you for teaching them about the base of the thumb point for immediate relief of tension. Even younger family members can learn these points as a simple stress management tool. In a sense, it becomes a multi-generational gift, bridging your own well-being with that of others. By spending a few minutes demonstrating or practicing together, you reinforce the importance of daily self-care that transcends age boundaries. There's also a psychological element. Focusing on these points can shift your mentality from feeling helpless about health issues to actively participating in your wellness. Rather than passively accepting aches or stress, you respond with a measured, constructive action. That sense of agency can boost mood and resilience. Feeling engaged in your own care fosters optimism, which itself can have a beneficial effect on your immune system and recovery from minor ailments. The 80-year-old doctor often remarks that positivity is a powerful medicine in its own right, and small rituals like this feed that positivity. If you're concerned about trying something new at an older age, the beauty is that each point can be tested gently and incrementally. If you notice discomfort, you lighten your touch. If you don't feel any benefit right away, you can experiment with slightly more pressure or a different angle. You remain the best judge of what feels safe and beneficial. The doctor encourages a sense of curiosity rather than self-judgment, reminding his patients that it's okay to start small or skip a day if you're not feeling up to it. Over time, as the routine becomes second nature, it often blossoms into a cherished moment of calm and reflection. In summary, these 3 golden points, near the inside of your wrist, behind your knee, and at the base of your thumb, can form a simple daily habit that fosters improved circulation, reduced tension, and a general uplift in how you meet each new day. Whether you're 60, 70, 80, or beyond, 5 minutes of mindful pressure and gentle massage can be a powerful tool. The real value, says the doctor, lies not just in the physical benefits, but in the mindset shift. You begin to see your body as something you can still nurture, not merely a machine in decline. Each day, as you dedicate those few minutes, you reaffirm your willingness to care for yourself in a practical, hands-on way. This fosters a sense of self-respect, essential for aging gracefully and with dignity. So if you're intrigued, consider giving it a try. Dedicate at least 5 minutes, once a day, to these points. Observe how your body and mood respond over the next week or 2. If it resonates with you, integrate it as a non-negotiable part of your routine, like brushing your teeth or putting on your slippers in the morning. If you have any major health concerns, check with a professional, but for most seniors in stable condition, it's a low-risk, potentially high-reward practice. You might be pleasantly surprised at how something so small can recalibrate your day. And as you find relief or renewed energy, you can share the knowledge with friends, neighbors, or family members who might also benefit. In that way, the doctor's legacy continues, passing along a tradition that affirms you are never too old or too set in your ways to explore a gentle pathway to better well-being. Let these golden points be a reminder that even in older age, pockets of vitality and comfort can be found in the simplest gestures of self-care.